Federal freezes and federal grants that have been rescinded are hitting the Dallas County Health Department. Good evening, I'm Clarice Tinsley. Last week, Dallas County Health Director Philip Wong learned 2 grants totaling $70 million were being immediately stopped. Now the county is trying to figure out what is next, including possible layoffs. Fox 4's Sean Rabb in the newsroom with exclusive reporting. Sean.
And we learned today that 52 health departments across the state were told to stop using those federal grant funds immediately last week. Commissioner John Wiley-Price had been sounding the warning bell for more than a month. No one was sure though when or if it would actually happen or what any financial cuts would look like until now.
This is really, was really a big hit, and we're one of the ones that are being impacted.
Impacted by what amounts to the loss of $70 million through 2 big federal grants administered through the State Department of Health Services. The state was notified that the federal grant funding for immunization COVID, epidemiology laboratory capacity, and health disparities COVID is terminated as of March 24th, 2025. The Texas Department of State Health Services issuing this notice to pause all activities immediately, adding, please do not accrue any additional cost as of the date of this notice. The notice came March 25th, 1 day after the grants were terminated.
So there was no preparation, no way to scale down, no way to plan for this. It's really very short-sighted in the way this is being handled.
The impact on vital services like immunizations, not just for COVID, but flu vaccines and childhood immunizations, along with HIV and STD prevention efforts, and it could mean as many as 80 scientists, researchers, disease detectives, and nurses lose their jobs. Reduction in force notices went out Friday.
On the 28th, our court administration started to, at least by our mandate, issue reduction in force. And then we began to scramble to see what other grants could absorb them.
While the county's looking for other grants that might save some jobs, hard choices are ahead.
The anvil has been dropped, and we've got to make some very drastic kind, of decisions.
There are definitely local cuts, and we're assessing the exact magnitude of it and looking at how we're going to be able to try to, move forward. But definitely there's significant cuts that we're facing.
And while the county tries to find other grant sources, the health department are going to have to look at current vacancies, not filling some of those positions to decide what vital staff can stay in place. Surely will be a big discussion tomorrow at Commissioner's Court.